Hello, welcome to From the South. I'm Laura Prada from our Telesur studios in Caracas, Venezuela. We begin with our news, but we begin checking out our headlines. The government of Venezuela presented new evidence of the foiled attack by U.S. and Colombian mercenaries. The unemployment crisis in the U.S. continues to worsen during the COVID-19 pandemic. Russia's foreign ministry has announced that terrorist organizations deployed in northern Syria continue to attack the demilitarized zone in Idlib province. We begin with our news. You stay with us. We begin in Venezuela. President Nicolás Maduro announced the strengthening of curfew and quarantine measures in border states with Colombia after 36 imported cases of COVID-19 were confirmed in the past 24 hours in the country.
We are making decisions to reinforce the border, to create quarantine capabilities at the border. All those decisions have already been made and are being executed. Curfews in the border crossing municipalities are being enforced. 14-day quarantine for all those who enter here. And then, when this quarantine is over, they arrive with their PCR test to their state. For example, Aragua, Anzoátegui, Monagas, Caracas, La Guaira, and they are submitted to a new quarantine.
Venezuela's Vice President Delcy Rodriguez gave an update this Thursday on the latest COVID-19 figures in the country, and she said she updated to 85 new cases of COVID-19, 22 national and 36 imported.
We must report that in the last 24 hours, we recorded 36 new imported cases, 14 from Colombia. Also yesterday, President Nicolás Maduro denounced, based on evidence, how the virus is being used as a political weapon.
Vice President Rodriguez also reiterated a complaint against Colombia's immigration authorities for promoting the informal passage of Venezuelan migrants through the border without any control protocols to prevent the spread of the virus.
Yesterday, in a meeting with international organizations, the Presidential Commission called for their intervention with Colombia's immigration authorities. Health workers in Colombia's border states are promoting the informal passage of Venezuelans without any control. We have evidence that they are being placed in transport units that are already contaminated, and that's why numbers coming in from Colombia are so high.
And the government of Venezuela presented new evidence of the foiled attack by U.S. and Colombian mercenaries. The Vice President of Communication, Jorge Rodriguez, denounced a link between the attackers and the Colombian gang Los Pachencas. He also denounced a link with Operation Gideon and drug traffickers in Colombia for the supply of weapons. Rodriguez said parts of the Colombian armed forces knew of the conspiracy against Venezuela.
We have audios that have reached us, not only due to leaks, but by indignated voices inside the Colombian armed forces who see the alliances between those armed traitors and deserters who are training in the northern region of Colombia, with the drug traffickers that supposedly the government of Colombia is combating, the drug traffickers that allegedly the DEA is combating. And Donald Trump announces operations against drug trafficking, but it seems that it has achieved the opposite. It has strengthened the powerful drug cartels in northern Colombia.
In a video confession, one of the U.S. mercenaries said opposition lawmaker Juan Guaidó hired Jordan Goudreau for a terrorist incursion and that he chose him due to his proximity to U.S. President Donald Trump.
Guaidó chose to work on it.
Why? Jordan Goudreau because of his proximity to Donald Trump.
Yes, it would seem that that's the impression that Guaidó has.
Are you aware of how much Guaidó paid in advance for training, weapons, and other logistics?
Before I was made aware of more information here. I was not, but I assumed that he was funneling money to support the mission.
Well, Attorney General Tarek William Saab has indicated that he sent a letter to the President of U.S. House of Representatives, Nancy Pelosi, to officially inform Congress on the mercenary raid on Venezuela territory on May 3rd.
Last Tuesday, a letter addressed to the Speaker of the U.S. House of Representatives, Nancy Pelosi, was sent and received. We provided information to the United States Congress on the events surrounding the so-called Operation Gideon, which was nothing more than an incursion to massacre, to generate a massacre, to commit terrorist acts by mercenaries hired by a United States company.
And public hospital workers protested in Brazil's capital over unpaid wages. In the midst of the pandemic, medical workers announced that they have not been paid for 2 months as demonstrators called for President Jair Bolsonaro's impeachment for his handling of COVID-19 crisis. More than 290,000 people in Brazil have been infected with the novel coronavirus, making the nation the third worst hit in the world, as nearly 19,000 people have died. Sao Paulo state, which has registered nearly 70,000 coronavirus cases and more than 5,000 deaths, has drawn far-right President Jair Bolsonaro's ire for closing non-essential businesses and ordering residents to stay home.
Today, we are now 15 days behind, so there are residents in several places in Brazil in the middle of the pandemic who have not received a salary. We feel completely insecure in the middle of the pandemic. We have a completely unstable government that does not follow the World Health Organization's recommendations.
We have just filled the most consistent, strongest, and most robust request for impeachment. More than 400 organizations, 6 political parties, leading figures from civil society.
In Argentina, President Alberto Fernández announced an extension of talks for the renegotiation of the foreign debt until June 22nd, and he said that they won't do anything that is not in their hands and put a bigger debt in their country.
We will not subject Argentina to new commitments that we cannot fulfill. I want the world to see us as an honorable country that fulfills its commitments. And therefore, we will not do more than we must do so that the commitments we make to our creditors do not mean a further neglect of our people.
Argentine scientists have developed a new rapid and low-cost test for COVID-19. Researchers at the Cesar Milce Institute of Medicine developed a new testing kit in order to help support the country's testing capacity. After proving its effectiveness and low cost, the government now plans to manufacture 10,000 tests and reach the target of 100,000 new kit COVID-19 tests per week.
It is a project whose fundamental characteristic is its simplicity. That means that with few chemicals, few elements within the kit, it develops quickly and the visualization is absolutely fast as it's visual. It would be around $8 to $10, which would be less than a half or even in some cases a third of what a PCR kit costs.
In Honduras, drivers protested to demand economic assistance from the government due to the mandatory lockdown. Main streets have been blocked by thousands of drivers and leaders of the transport sectors in various regions of the country. The protest disrupted citizens' mobilizations in the Honduran capital as the country reports over 3,000 cases of COVID-19 and 151 deaths. Time for a first break. Remember, follow us on Twitter at Telesur English and on my account at Laura P. Telesur. We'll be right back with more news. We are back with our news. Unemployment crisis in the United States continues to worsen during the COVID-19 pandemic. According to the Department of Labor, nearly 39 million people have lost their jobs despite the easing of restrictions. A projection by the Federal Reserve points out that the unemployment rate could hit 25%. However, the country also faces the coronavirus crisis, which has continued to intensify over the past 2 months, with over 1.5 million cases and almost 95,000 deaths reported. Meanwhile, Guatemalan President Alejandro Yamatei blasted U.S. President Donald Trump over the deportations of migrants infected with coronavirus. The deportations saturated quarantine centers in Guatemala and heaped pressure on the Central American country's weak health system. As of Thursday, 119 Guatemalan migrants were diagnosed with the coronavirus. The Central American country had requested the U.S. immigration authorities that the deported migrants be examined before leaving their territory, 72 hours before boarding their flight, to determine whether they were carriers of the virus. The president explained that the arrival of infected migrants is overloading the precarious health system, which has caused serious problems for the country. In Guyana, the recount of votes cast in March 2nd general election continues, with 72 ballot boxes tallied on Wednesday at the end of the day. Guyana's Election Commission began a 25th-day recount to declare a winner starting May 6. The total number of boxes recounted so far is 789 out of the 2,339. In an effort to speed up the process, GCOM chairperson has announced plans to ask the National COVID-19 Task Force for 2 more workstations. And 8 ranks attached to Guyana's Presidential Guard have tested positive for COVID-19. The police force said the tests were conducted randomly and the patients have been quarantined. However, the director of the public information of the Ministry of the Presidency assured that the ranks are not a part of the Special Protective Service arm of the unit, so they were not responsible for the close protection of President David Granger, who has been working remotely, nor his family. And Antigua and Barbuda's Prime Minister Gaston Brown has rejected the United States' decision to block medical supplies from reaching some Caribbean countries to fight the COVID-19 pandemic. He spoke during an exclusive interview with Telesur.
I thought it was somewhat myopic for them to have intervened and to stop those shipments, because they were not significant. They would not have made a difference in terms of the health response within the United States. I think it was very unfortunate, but notwithstanding that, we were able to get supplies elsewhere to the extent that our pre-COVID situation, which was very vulnerable, we would have strengthened our health infrastructure.
Jamaica's Prime Minister Andrew Holness said he is mourning the death of the 153 elderly woman who died in a fire 40 years ago. The fire ravaged the Inventine home on May 20, 1980. Holness described it as a heartbreaking catastrophe and dark time in the country's history. He promised to never let such an incident happen again. He tweeted, "Today, I honor the memories of these beautiful souls we lost and pledge to do all we can to protect and care for those in state or private care facilities for the elderly." And Cuba's scientific community is continuing its work to look for alternative ways to fight COVID-19 as the nation grapples with the pandemic and the unilateral sanctions imposed by the United States. Let's find out more on the following story sent by our correspondent, Nayara Tardo.
In under 7 days, in a biotechnology center outside of Havana, scientists created a transport method that could conserve the virus known as SARS-CoV-2, using it for the more than 80,500 tests taken on the island.
This product is often imported, but due to the global crisis, most of the nations that manufacture the product were not allowed to export. That's why, under these shortages, we designed our own method.
The cotton swab used to take the sample in each PCR test is placed in this container, which prevents contamination during transport. In Europe, each of these costs €40, but thanks to Cuban ingenuity and the use of national products, demand will be met.
This is one of the products that we are producing for the fight against COVID-19. We guarantee the entire life cycle of this product, and it is made under the required quality guarantees.
Biomodulin T was also created in these laboratories back in 1994, and it's one of the drugs that is part of the medical protocol in Cuba to use in treating COVID-19. To this day, the protocol has been used on over 5,000 people over 60 in retirement homes.
It creates different reactions in the immune system for that it's used to treat infections in senior citizens.
After 2 months since the first reports of COVID-19 cases on the island, one of the best experiences in treating the virus happened when a patient was diagnosed in a retirement home. Thanks to Cuban-made medicine, an outbreak was averted.
Impressive alternative, and China is committed by assisting Caribbean countries affected by COVID-19. Tian Qi, ambassador of China to Jamaica, said on Wednesday that the Chinese collaboration will be material and technical assistance and sharing of lockdown experiences and treating solutions and facilitating the purchase of medical supplies. The ambassador also said China will actively expand all-round practical cooperation with Caribbean countries in areas like treatment and investment and strengthening communications and coordination in international and regional organizations. In the Caribbean and with China, they have delivered a donation of medical supplies and financial resources to assist Cuba battle against the novel coronavirus. During a ceremony at the Cuban Health Ministry, Chinese ambassador to Havana, Shen Ji, noted that the recent address by President Xi Jinping during the 73rd session of the World Health Assembly offered important guidelines for the future fight against the pandemic. Ambassador Shen delivered the materials and funds donated by the Chinese Red Cross to the Cuban authorities, including COVID-19 test kits, face masks, and surgical gloves, among other protective equipment.
This year marks the 60th anniversary of the establishment of diplomatic relations between China and Cuba. In the midst of the growing uncertainties and an ever-changing world, the importance of the traditional and fraternal friendship that unites us has been further highlighted. We will continue to support the efforts of the Cuban people in the fight against COVID-19, and we are ready to work together to promote exchanges and cooperation in various sectors. We are convinced that Cuba will overcome this epidemic and continue with firm steps in the construction of socialism. China has been an example of how to act in an area as complex as the epidemic, contributing experiences, providing resources, and sharing its experiences as the first country that was subjected to the epidemic. We follow the statements of the Chinese president, we support them, and we know that they will be a faithful reflection of what China represents for the world in this great battle.
Time for a second break. We'll be right back with more news. Russia's foreign ministry has denounced a terrorism organization deployed in northern Syria continued to attack the demilitarized zone in Idlib province. Russian Deputy Foreign Minister for Counter-Terrorism Affairs Oleg Seromolotov said that terrorists from the Al-Nusra Front and other extremist organizations are taking advantage of the COVID-19 pandemic to increase their presence in the region. But while the atmosphere in Idlib is tense, Moscow maintained the agreement signed with Turkey on the zone of restrictions and are still in play. The government of Bashar al-Assad has also warned of a possible armed response if terrorist organizations insist on breaking the ceasefire in the region. In Uganda, over 5,000 people have been displaced from their homes due to floods which have been impacting East Africa, according to official sources. Overflowing rivers as a result of torrential rains have caused grave damages to the infrastructure of the region of Kaese, where hundreds of houses and also a major hospital have been destroyed. Inhabitants of the community have been transferred to schools, serving as refugee camps and aided by the Red Cross. And Kenya's Ministry of Health has increased testing for COVID-19 as the country has confirmed more than 1,000 cases. Health care workers on the front line were among those screened for the virus. The ministry announced plans for mass testing after increased reports of asymptomatic cases. It said high-risk clusters would be prioritized, including slum areas, hotels, hospitals, quarantine centers, and isolation facilities.
We have had to really increase our aggressiveness in dealing with infection prevention and also specifically tailored to COVID. That means screening of every person who walks into this hospital, whether it's a visitor or an actual client, they have to be screened. We have controlled movement within the hospital, controlled distance in our waiting bays, and even extremely restricted the visits into the hospital.
And the landfall of cyclone Amphan increased the death toll to 80 on Thursday after battering India and Bangladesh. Amphan leveled thousands of homes, flooded streets, uprooted trees, collapsed buildings, and left cars window deep in water. The worst damage was reported in India's Kolkata. Many villagers ignored calls from their evacuations as they feared they could be infected with the coronavirus. In France, health workers in Paris demanded more resources for public hospitals. Hundreds of protesters and some members of the Yellow Vest movement gathered on Thursday in front of Robert Debré Hospital, demanding better salaries, more medical personnel, and better working conditions. They also denounced the shortage of protective medical equipment and the lack of investment to improve the service in hospitals.
Neither medals nor holy vouchers are elements that can satisfy us in any way. Our demands are always the same: more nursing, medical, paramedical, labor, and laboratory staff at all levels of all strata of the hospital, and the financial recognition that goes with it. That's what we are looking for.
And several international organizations are nominating the Cuban medical brigades for the Nobel Peace Prize for their work fighting COVID-19 around the world. 26 brigades of Cuban doctors are currently working in over 20 countries and have helped almost 30,000 patients fight COVID-19. The Henry Reeve Brigades were created by the leader of the Cuban Revolution, Commander Fidel Castro, in 2005 and have provided more than 1,200 health specialists to treat the coronavirus.
We are grateful to be considered heroes by so many in the world. But we are nothing but doctors, but we've had to play a large role combating this pandemic.
Like this, we come to the end of this news brief. Of course, you can find this and much more other information on our website, telsterenglish.net, where you can read opinion articles, watch special interviews, and of course, keep yourself updated about the latest figures in the world related to COVID-19. The invitation has been made. You continue with us with Telesur, always together, connecting our global thousands. Until next time, thank you for watching.